Welcome, everyone. Hello, and thank you for joining us this evening for this professional development webinar. My name is Stephanie Shivers, and I am the Chief Innovation Officer and Vice President of Program Development here at CaringKind, and it is my pleasure to welcome you to this webinar this evening. We'll get started with Dr. Epps and a few visitors in a few minutes, but while folks are joining us, let me just take a couple of minutes very quickly to talk a little bit about our organization and our aspirations for this professional development webinar series. So for those of you who are not familiar with CaringKind, we are one of the country's oldest not-for-profit charities focused on providing care and support for families who are impacted by Alzheimer's and other dementia. We are one of the country's oldest not-for-profit charities who have been in this space. And throughout our 45-year history, we've been one of the leading community-based organizations in this field. And we continue to innovate and launch new programs and evidence-based services in what we call the real world. We are based here in New York City, but we do have a national reach through our virtual programs and services and educational offerings. At CaringKind, we serve kind of the full spectrum of individuals, families, businesses, communities that are touched by Alzheimer's and other dementias. And we do this through a host of programs and services and educational opportunities for people with Alzheimer's or any form of dementia, for their family members, their partners, their friends who are providing care or support, for the healthcare professionals and direct care staff and aides and service providers who are meeting the needs of people and who need dementia training and coaching. And we also work with residential and community and cultural organizations who need training to become more dementia capable or dementia friendly. And we deliver our services in a variety of ways: one-on-one sessions, helpline services, small group programs, educational webinars and seminars, in-person trainings, virtual trainings, special events. So we're pretty busy here at CaringKind. And here you can see a quick overview of the types of programs and services that we provide for individuals and families, including our helpline. We do navigation and consulting services. We have education workshops, skill building and support groups. And we also have a comprehensive suite of programs for individuals with mild cognitive impairment and folks who are in the early stages of their diagnosis. We also provide workforce and dementia-friendly trainings, and we are working diligently to really advance our field through research initiatives and professional development programs like the one that we're hosting today, which is why the professional development box is highlighted tonight. We offer services in a number of languages, and for those in particular cultural communities and affinity groups. And thanks to our donors and our supporters and the tireless fundraising efforts of our development team, our services are all free of charge to individuals and families. At CaringKind, we intentionally collaborate with other providers, social service, aging service, researchers, healthcare professionals, in an attempt to really provide a network of support around the individuals and families that we are all seeking to serve. And if you are directly working with people who could benefit from our free programs and services, we want you to know that you can provide a direct referral to our team through an electronic form that's available on our website. And there's a QR code there for you. You see the email address and the web address there for. There's electronic form, and there's also a PDF version that you can download and email or fax to us if that's a better solution for you. We're going to be offering CEUs and certificates, and we'll do that at the end of the webinar. So stay tuned at the end. So we'll show you how to do that. And also we are recording this seminar tonight, and we will make that available on our website for you all, and we'll make the handouts available for you as well. The way this is going to work tonight is that we're going to save the questions to the end, but we want you to feel free to go ahead and add questions to the chat at any time, and then we'll keep track of those and bring them back up as we approach the end. And I'm assuming that you all are familiar with Zoom if you're on the call here tonight, but if you aren't, there's a button on your toolbar where you can click chat, and that's how you type it in. And the way we'll work this also is that right now I'm spotlighted and you'll be seeing the folks who are speaking. And when we move to the Q&A, we'll open up the gallery and you can turn on your videos and you can raise your hand or send an emoji and we'll call on you and unmute yourself so that we can hear directly from you. Or like I said, you can put your information in the chat. At this point, I think everyone is here, so let me formally welcome you all again. Thank you for joining this professional development webinar here at CaringKind from the voices of Black dementia caregivers. My name is Stephanie Shivers. I'm the Chief Innovation Officer and Vice President of Program Development at CaringKind, and we are very excited to host this webinar tonight, which has been made possible in part through the generous funding from the Hearst Foundations. CaringKind is committed to advancing best practices and evidence-informed interventions, and we are thrilled to be able to offer this webinar tonight, and we will be doing this on a regular basis, trying to really bring forward the exemplars in our field to share their learnings and to share what's working, and so that we can all benefit in a really multidisciplinary way how to best serve the families whose needs we're seeking to meet. So we're very excited to be here tonight and to welcome Dr. Fayron Epps and Tanya Brown and Mark Williams with us. So let me tell you a little bit about Fayron, the amazing Fayron Epps. Tonight is leading this webinar with us, and Dr. Epps is a nurse and a researcher who is specializing in dementia care, family caregiving, and health disparities. She is a professor and the Karen and Ronald Hermann Distinguished Chair in Caregiver Research at the University of Texas Health Science Center at San Antonio School of Nursing. And her work is centered around promoting awareness, education, and support for families affected by dementia, particularly within the African American communities. Dr. Epps is known for her community-engaged research and her efforts to partner with faith communities, in particular through her Altar program, to improve dementia care and resources. And her work bridges the gap between research and real-world application by ensuring that her findings directly benefit the population she serves. She has received various accolades and funding for her innovative work in health equity, dementia care, and community engagement, including being the 2022 recipient of the Innovations in Alzheimer's Caregiving Award from the Caregiving Alliance. We are thrilled that Fayron is willing to be with us tonight and to share her learning and her insight and so generously with us all. And I'm sure that you all will enjoy her leadership in tonight's conversation. We are also thrilled to have two care partners with us this evening. And so we welcome Tanya Brown, who has been a long-distance caregiver for her parents for over 20 years. She's been traveling monthly to relieve her sisters and nieces, providing well-needed breaks they need throughout this time. She is an advocate of Alzheimer's research and helps guide caregivers with the knowledge she has gained over the years. She's an active board council member for 3 organizations related to Alzheimer's research and caregiving. And she is joined by Mark Williams, who was the caregiver for his wife, Lisa, for 8 years until she recently passed in September of 2024. Mark has an 18-year-old son as well. So thank you all again for joining this evening. We have a few learning objectives for you all. And so the goals tonight are, by the end of this presentation, you all should be able to identify 3 unique experiences of Black dementia caregivers. You should be able to list 3 topics covered by the Caregiving While Black course. You ought to be able to name 2 ways that research has shown the Caregiving While Black course benefits caregivers, and to discuss ways healthcare professionals can build trust with the Black dementia caregivers. And with that, I am going to excuse myself and turn this over to Dr. Epps. Thank you again.
Sure. Thank you, Stephanie. That was some great learning objectives. Let's make sure we meet those throughout our presentation. So good evening, everyone. I'm so glad you all are taking time to join me along with Tanya and Mark for us to really talk with you about Black dementia caregivers, their experiences, and the need for culturally responsive education on navigating care systems. So as we get started, next slide. I just want to kind of reiterate, a lot of my work is about promoting quality of life for families affected by dementia, particularly African American families, and creating innovative research programs, test new models of care so we can address the needs of diverse caregivers. And as Stephanie mentioned before, placing these programs and interventions in the hands of those who need them the most. And that's really sums up my work that I do, the work that I'll talk about tonight, but then any other work that I'm involved in, any research, is all about promoting, creating, and placing it in the hands of those who really need it. Next slide. And so our work that we'll talk about tonight has been funded by various sponsors: RRF, Foundation for Aging, UC Davis, their Betty Irene Moore Fellowship for Nurse Leaders and Innovators, where I am a fellow. And then also National Institute on Aging has also funded some of the work that you'll hear about tonight. Next slide. So these unique experiences of Black dementia caregivers, okay, I just want to start off and just put this out there. We know um, caring for someone living with dementia just across the board is challenging, right? It can be rewarding and it's challenging, and it comes with these different types of experiences. I want to make sure that we acknowledge that. But tonight, I want to speak with how the color of someone's skin can add a unique experiences to their caregiving role, through their journey trying to support someone living with dementia. And many times people come and say, well, why? And so tonight we want to share with you some of the things, and you'll hear from Tanya and Mark later, and they can give their own personal testimony as well. Um, and so, due to the disadvantaged social history of Black Americans, there are several unique stressors, vulnerabilities, resources that inform and affect the Black dementia caregivers' experience and well-being. And so, if we got to think about the health, the socioeconomic disparities, as well as systemic racism. Y'all, this exists, and they are barriers for healthcare access and navigation for caregivers. So we have to acknowledge that. And yes, in 2025, a lot of things are in place that prevents many of these families from getting the care that they need, from being able to advocate. And so these are the things that we want to acknowledge and address as these are problems. Next slide. In the Black family, particularly, a lot of your support systems are made up of family, church members, community. Oftentimes, these care teams or families, they have limited financial resources compared to other groups that are coming into this with a lot of generational wealth that they can bring in extra resources and extra assistance. Where in many of the Black families, you do not have that. Also, our Black families have less access to support services and primary care. They have more unmet needs for their person living with dementia. And so, again, that's just their access to these resources. It's not really there. And I will tell you, um, it's really not about, I'm sorry, about the education level or the income. I always tell what people when I was living in Atlanta, despite me having however many degrees or however much money I may make, I still was living on the south side of town because that was the safest place to raise my kids. But this area didn't have health care. We didn't have the healthy foods that we need to engage in. And so it was me traveling 40 minutes if I need to go to the emergency department or get these additional resources. So it's things like that I want you all to consider and think about. Also, in the African American family, Black families, they engage in more hours of intense caregiving, and they use more of their income to help with the caregiving duties. And so again, that goes back to not having the financial resources or anything that they can fall back on. And so we want to make sure that we acknowledge that as we look at our clinicians, our primary providers. A lot of our Black families are saying that they are being disregarded or dismissed when they come and bring their concerns. I had someone even living with dementia who I asked to follow up with their primary care provider, and that provider said, "Oh, that's a joke. You don't have this." And she really didn't have some concerns or that needed to be followed up on. And so again, being disregarded, dismissed, these things happen, which makes it harder. Either you're going to fight and get the care and try to get the resources, or you're going to just say it is what it is. And then it's all just left on you to try to figure things out. Next slide. So we have, based on this work, we have published 2 papers, one falling between the cracks, the experiences of Black dementia caregivers navigating the U.S. health system. So I would really ask you all to look into this, their experiences during the pandemic. These are good resources to hear from the caregivers about their experiences. And as we go into the next slide, all right, that was my key. Next slide. We're going to talk about this course, right? So I presented to you all the problem. And so now we want to share with you a piece of the solution, if I can say, and that was us developing an education course that is culturally responsive to these unique experiences of Black dementia caregivers. Next slide. We did a focus group with some caregivers, and it was 16 caregivers. We did these focus groups 22 and 2023, and we held a series of focus groups, and we talked about how do we refine a psychoeducation course, why is a specific course needed. Next slide. And 4 themes came out, and I know Tanya and Mark would talk about them a little bit later, but one of the things came out was limited accessibility opportunities for education and resources. And if you can see the last quote at the bottom, I won't read everything to you, but that last quote, a caregiver said, "Our resources are different." So, I mean, reality, the things that exist in a Black community is different than other communities. And you can just look at a grocery store. I see this all the time being a qualitative researcher when I go out in communities. I can go to a high affluent community and same grocery store is really nice and clean, and go to the same grocery store in a low income or a predominantly Black neighborhood, and it looks totally different, but same chain. Even the quality of the foods are different. And so here the caregiver is saying our resources are different. We also we have our own cultural identity. Needing a course like this creates a space to feel seen. And then last but not least, a sense of empowerment. It gives the encouragement to still continue to do that extra research and take that extra step to find out what it is that you need for your particular situation. So that goes back to what I was saying. Sometimes, many caregivers just like, it is what it is. Let me just go back and do what I have to do. But having a course that really speaks to them and their unique experiences, it empowers them to continue to advocate and I have to use that word, and to fight for the care that they know their family member deserves, and also the care for themselves. Next slide. So we created this pilot course, which is called Caregiving While Black. Next slide. So Caregiving While Black, what we'll talk to you about today is an all asynchronous course, which is it's all online, it's self-paced. We give caregivers 2 months to complete it. It is a for us, by us course. So this is persons living with dementia, Black caregivers, Black healthcare professionals. We all came together to create the content for this course, to shoot the videos. Having an instructor, a provider that reflects the learner or that reflects the patient, that has been shown in the literature that is real key. Now, we know that's not the only way, and we know it's not always possible, but in this course, we wanted to make sure that we do capture that. It is about 8 to 10 hours of course content. And like I said, we have videos in there, and we've had some interactive segments embedded in the course as well, to just keep the caregivers engaged while they're learning. Next slide. These are some of the course topics. If y'all remember, the learning objective said, what are at least 3 course topics that we have in the course? And when you look at these topics, y'all, these are topics you may say, well, every caregiver needs this, and not even a caregiver. Everybody needs to know these things. And I'm not going to argue with you. But the angle that we're approaching this is that we know, yes, every caregiver should know this, but particularly in the Black community, even if they are presented with this information, sometimes it's not relatable. And so we're trying to make sure that we address the culture in the community around some of these topics like financial planning and address it and then give some relatable tips and advice. Next slide. These are examples of the individuals, the professionals, the caregivers, even the pictures that we have in the course. So you can see it's really trying to reflect our learners, our Black caregivers. So you have someone teaching Jordan Murphy, she's a nurse, she's teaching about resiliency, can't even speak, I'm sorry. And then you have Dr. Wiley, she was talking about infectious diseases. Matthew Johnson, he's a caregiver, so he's talking about him being a distant caregiver at first, and he was in denial. So sharing his story, hoping that it would connect with other caregivers. Next slide. And this is also another picture of Dr. Harris that's speaking about having diversity in your care team. And this is her, she's talking about healthcare professionals and diversity. She's relating to the roles, the diverse roles of many of the clinicians and providers and how important that is. Next slide. We also provided additional resources. So we provided a glossary, a study plan, a workbook. So we were just trying to give them all the resources that they need. And we looked at this as foundational resources. This is just a starting point. So now they can go on and engage in other courses and programs to continue to learn. Next slide. So let's talk about our findings. And I know Tanya and Mark will be joining me in a little bit. So we can go to the next slide. And I'm just going to briefly tell you all what we saw. We had, in this first pilot study, we had about 33 caregivers that completed our course. Average age was 54. Most of them attended college. And I want to just put a plug here. A lot of folks, when they look at our studies, my studies, they say, oh, it's a highly educated sample. And so I'm like, okay, Black people are highly educated. That's what it is. So I just want you all to think about that, right? Because sometimes, and to me, people can take offense because this is not 1950 or 1960 where maybe everyone didn't have that opportunity to go to college. So for everybody that's tuning in tonight, I want to let you all know that yes, as you look at the Black community, the Black population, more people have went to college, graduated from college, and had advanced degrees. So I think it is okay to say that I have 90% of my participants that have went to college. And that doesn't mean they don't live in a rural area, because I've had caregivers that have went to Howard, graduated, left their jobs, and moved back to a rural area to care for their mother. So again, they're in this area with no resources. So I just want to just kind of put that out there so we can change the way we think, especially when we're looking at populations that have been underrepresented in research. 81% was female, 78% cared for a parent, and the average hours they spent in the course are about 12 hours. Next slide. So quickly, out of these 33 folks, and we know it's a small sample, so we're doing a larger study now. We did see an improvement in caregivers' emotional well-being, and that meant that they was improvement in their depression symptoms, burden, and even role strain. And we did a pre and post test, and we were able to see that. We also saw a slight increase in caregiving mastery. And caregiver mastery is more that caregiver feeling more competent in their role to be able to now care for their loved one. And so again, we're still looking at that in this larger study. So hopefully we can see more of an increase that will be significant. And then we also held in-depth interviews with some of the caregivers to really fully understand their experience in the course. And many of them appreciated the cultural recognition and had that feelings of empowerment. And we kind of talked about that earlier, that was the goal that's how we were trying to go into this course, looking at it like that. Next slide. So we did have some caregivers that did not complete the course. Uh, so because we enrolled about 75 caregivers in this pilot study. And what I wanted to highlight here was the reasons why they didn't complete the course, because we're going to talk about that later. The lack of motivation, they wanted more guidance, and they desired some face-to-face interaction. So for this pilot study, this was all online. We enrolled them in the course. We checked in on them, just, kind of nudging them to take the course. But that was pretty much it. So again, remember, lack of motivation, they wanted more guidance and desired face-to-face interaction. And I will connect back to that in a few slides. So now, again, I would like to introduce Tanya and Mark to the platform with me so they can share their experiences. Mark and Tanya both serve on our Family Caregiver Advisory Board and have been very influential in us developing this course and having several reiterations. So I would love for them to share with you their experience taking a course or just being involved in the development of the course. So I will start off with Tanya first.
Okay. Hi, everyone. I hope everyone's having a great, what is today, Wednesday evening? Yes, as far as the course, I think it is an excellent source, an excellent resource for our community. One of the things that when our parents were diagnosed, one thing that we had issues with was finding the resources, knowing where to go, knowing where to get the information from. And it started from day one, even from the doctor's office. We asked, we were told that our mother was diagnosed with Alzheimer's, and we were asking questions like, okay, what's next? So the doctor, in so many words, told us, okay, you're going to have to research that. And with us not knowing or having any family members having this disease, we really did not know where to go. One resource that I found was Alzheimer's Association. That's where I got majority of my information. And of course, asking question and learning more about it. But it was quite difficult. Not knowing that we had to get financial documents together, not knowing about the legal documents that we had to get taken care of. There were a lot of issues that we faced that we had to move quickly on because some of the information was not in place. And thank goodness my father at the time, he was able to make some decisions. He and my mother had made decisions previously, but nothing was in writing. So we're just very thankful that we were able to work together to get the documents that we needed. And that's one thing that I stress as a caregiver, a long distance caregiver, is sharing that with people who are having the same experience. And this course that Dr. Fayron has put together and has her advisory team, this is right on point because it covers so much information, things that many people who are not involved in, that they may not even think about, something that they need to be taken into consideration.
Thank you for that, Tanya. I'll pass it over to Dr. Mark Williams.
Good evening. My journey with my wife was a little bit different for several reasons. One, of course, me being a man. Two, well, really one, she started developing dementia at 48. Me being a man, so I had some I would always get this thing about, instead of us talking about resources and things that I can do, I was often commended on being there for her as a man. To kind of piggyback on one of the things that Dr. Epps said about the generational wealth, not only do other communities have the generational wealth, but they also have more than likely in their family or in their network, people who are in the healthcare system, people who are in the legal system, who can help them navigate some of the things that Tanya was just speaking about. They also have better planning because they may have had family members with the disease and they were very open about it. Whereas you'll find with some Black families, they tend to put them in the room and close the door, kind of like when you see on those old TV shows, the elderly person who they call crazy in the back room. One of the things that I appreciated about the class is that it opened me up to others who were in my situation, and I was able to form a network with them, which led me to other resources such as groups for individuals who were dealing with Alzheimer's or other related dementias. One of the groups that I attended that happened to be predominantly white in terms of what you would hear of, like what Dr. Epps was talking about when she said the 94%. Some of those we call racial microaggressions. And one of the things that I was often commended on is how well I spoke. And I just kind of chuckled and, told the individual that at work they do call me doctor. So, my background is blurred, so she wasn't able to see the many books that I have back there as well. I also experienced that while advocating for my wife. I found that when I went in wearing a suit or a blazer, tie, bow tie, that I was better received than when I went in wearing my youth basketball coach gear. And just like with Tanya, we were going to a neurologist, and I was giving the neurologist more information in terms of resources that the neurologist was giving me. The other part about my background that made it a little bit easier for me is that I'm an only child. I moved here on my own to Georgia at 18. So I always found myself fending for myself. And anybody that knows me, and Dr. Epps has known me long, but she knows that I'm not afraid to speak up and ask the questions. I will do research. I was kind of lucky in the fact that I went to Facebook and found a group specifically for frontal temporal dementia. It was called FTD Spouses. And in joining that group, I became friends. A lady reached out to me, Sharon Hall, who I found is the FTD guru advocate for the state of Georgia and the US. She connected me with resources such as an elder care attorney. By me having worked in the school system, I knew social workers. So I reached out to social workers that I knew to see if they knew any medical social workers. And Kaiser was real good. Kaiser was our insurance company. They were real good in having us sit down after she was officially diagnosed with a team of people who gave me resources and individuals to look at, like a Teppa Snow and some others, and just me willing to get on social media and locate resources. Um, so, and I think we're going to get to that last part. I'll save that for the last part when we talk about what professionals can do to be, more aware and more engaged when it comes to those individuals of color.
Thank you, Mark, for that. And hopefully that helps the learners a little bit again, why this course exists and how it is helping caregivers. And one of the things I did leave out to let you know, the 3 topics. So I gave you the lesson topics, but the overarching themes of the course, I should say, is teaching our caregivers how to navigate healthcare systems, how to navigate or manage home life, and also how to take care of themselves. So those are the 3 things, and that's self-care that we kind of focus on. Next slide. Oh, well, we want to do the takeaways. Well, let me finish and then we'll do the takeaways for professionals. So we're going to go back. So let's pass that slide and let me just tell you all our next steps. And then we can open it up, and Mark, we can go back to you for the takeaways for professionals. So as we have this course, what we're doing next is I mentioned, and you can go to the next slide. I mentioned currently we're doing a larger trial, which is a randomized control trial for this online course where we're enrolling 140 Black caregivers, and we are measuring the same thing, the emotional well-being, mastery, and looking at their reaction to their persons living with dementia, the signs and symptoms. So we're hopefully will be able to report those findings this year. And then we're also, if you all, next slide, if you remember the reasons why those caregivers did not complete the course, lack of motivation, I believe it's something about guidance, and also not having face-to-face. So we wrote a grant to NIA, and we got this one funded called Caregiving While Black Live. And so this is where they still have the online content, but we have embedded weekly face-to-face live sessions that we are doing through Zoom, or they can be done in person for us to motivate the caregivers to keep going through the course, but also for us to guide their learning and be there to reinforce what they have learned. And so it has been beautiful. We're currently taking that testing this version of the course now and looking at the preliminary efficacy and then the usability, acceptability, feasibility. So I can tell y'all right now, it is a hit. We have a wait list for people to show up for this course. So hopefully, again, we'll be reporting those findings toward the end of the year. Next slide. So I just want to tell you all, I feel that me personally, feel that there's an urgent need for culturally responsive education that addresses the unique challenges of Black dementia caregivers, but also the unique challenges of all caregivers from diverse communities. I think it's so important for us to recognize someone's cultural background really influences the care that they receive or influences their journey. And as providers, we need to recognize that it is not one size fits all. And education provides an opportunity for us to empower caregivers, reduce stress, and improve caregiving outcomes. So as I wrap up tonight, I thank you for your time. I would love for us to go back to that slide where we talk about key takeaways for professionals, and have Mark and Tanya maybe speak to that. This is your opportunity. What do we want the providers, the clinicians to really know as they help and serve other caregivers? So I'll turn it back over to you. Mark, you want to start, or Tanya? Would you?
I can start. I would say now, who can I get a sense of the professionals? Are there social workers, counselors, psychologists? What who are these professionals?
Go ahead and put your profession in the chat, everybody, so they can see who's on the call.
Nonprofit, social worker, social worker. Okay, medical social worker. Okay, occupational therapist, nonprofit, licensed social worker. Okay, I would say I would say Jerry. I would say in terms of the social workers seem to be a little bit more socially aware than the others. There were some, I would say microaggressions from the nurse who came to the house and was just kind of in awe that my lawn was green, that we had, art on the walls, uh, that we were not, basically living I don't want, that we weren't impoverished. I guess I would say that. There were people who were surprised that my wife and I both had a certain level of education, that I have a doctorate and she had a master's. Uh, Again, the lady surprised that I could speak well was an issue, not necessarily for me, because at that time I was 54 and I've been dealing with race and racism a majority of my life. Um, in terms of dealing with attorneys, I think they were a little bit different because we were paying them and they just wanted to make sure that we could pay for the services. They really could care less. But in terms of the professionals and the helping profession, I know as a counselor in our in our area of social science, we always took a class that had to deal with culture, diversity and multiculturalism. At some point, they changed it to social justice. So I would say, even though in those textbooks it may be a small chapter on, Black people, I would just say in your own journey, maybe if you're dealing with people of color, I would say take the initiative to learn about the population you're dealing with. And even if it is a Black culture, you still have to be careful with that, because my wife was Guyanese, so that Caribbean culture is going to be a little bit different than the, African American culture. An African American from the Midwest and the Northeast is going to operate a little bit differently than the African American in the South. So I would say go in and observe and ask questions like, what do you need from me? How can I help? As you get to know those individuals, and then move forward from there. Those are always a great place to start. What can I do for you? What do you need from me? How can I help? And use your, if you're a social worker, use your counseling skills to extract the information you need if you're not getting the answers you're looking for. I see there's a research analyst on here. We have some people in the nonprofit. Don't be surprised that there are 94% of Black people with degrees, and they're taking a class to learn how to be a better caregiver. Because my background, my bachelor's is in accounting, my master's is in school counseling, and my doctorate is in leadership, and nowhere in there did I ever take any course or any class about being a caregiver, or know what to do if I was saddled with being a caregiver. And I'll turn it over to Tanya.
Yeah, Tanya, would you like to add? And thank you, Mark, for that.
Yes, thank you, Mark. Yes, I agree with that. And as far as the social workers, I think it would be great to collaborate with neurologists, or providing information that they could provide to patients who have just been diagnosed, or not the patient, but to the family member. Um, that was very important to us because we did not have that information. And if there's a resource, such as a physician has made an announcement or told the family that their loved one has been diagnosed, have a second person they can refer them to. I think that would be a great program. Whereas I was looking at some of the professions on here, could collaborate with them on by giving them 5 minutes, because this is a lot of information to swallow, finding out your brain will eventually deteriorate in so many forms, um but having the resources there when they find out is very important. So I don't know if your organization can create some, or you can get some from other resources such as Alzheimer's Association, but have some place for the family to go to obtain more information. Um, as far as, let's see, geriatric caregivers, social worker, research assistants, it's all about educating people on more about the disease. Um, Although there's no two Alzheimer's person who go through exact same things, give them examples, but let them know that everyone would not go through the same thing because every person is different. That's what I would like to add on there for regarding takeaways for professionals.
Thank you so much, Tanya. I think that's been very valuable. And I'm looking in the chat, and I will turn it over to Stephanie in a little bit. But I think one of the things, I believe, if it's from Jed, hopefully I'm pronouncing your name correctly, is they asked a question about how can we provide some examples of how the culturally relatable changes that we made in the content of the course. It would be helpful to hear that. And I want to let you know, it is not that we change the content, it is how we presented the content that is different. So it's the same information that can be in our general caregiving course that I do. I developed at Emory with my colleagues. It's just how it's presented now, and me bringing in Black professionals to kind of go over the content that we have written. We also check the literacy level, and we try to um, make sure that it wasn't big words that may not be familiar with, not too much medical jargon, I should say. We did that as well. Mark and Tanya, is there anything else we addressed? So also in this course, we added things in. So we address the health inequities that exist
Mhm,
in the Black community.
mhm,
And so we took that time to make sure we show them this and let them know what's going on in the Black community. And any of these conditions that we talk about, if it's more prevalent in the Black community, we spent a little bit more time providing instruction and resources. For example, vascular dementia is significant. We'll see that a lot of that in our Black community.
mhm.
Mark and Tanya, anything else that may be left out?
Yeah, we also added talking about planning, in terms of getting with elder care attorneys, financial planners, uh, insurance that you may need, and being able to prepare on the front end for the burial versus when you're emotional and you may not make wise decisions and
Mhm.
overspend. So we added that as well.
Mhm. We also added, as far as long distance caregivers, which I am 200 miles from where my parents live, and I've been traveling over the past 20 years every month to help relieve my siblings and nieces. It takes a village when you're caring for someone with dementia.
Mhm.
And what I would like to stress is that those who maybe long distance, they can still help long distance. The arrangements that my family have, I deal with all of the finances because that's something that you can handle long distance.
Mhm.
Um, and I come when I can. Long weekends. This week I've been here a week. Last month I was here for 2 weeks. But the further they go into their different stages, the more care they require. Um, but I'm just speaking from a long distance caregiver. There are different roles, but it's best to have a schedule when you have a family. Sometimes you can have a big family, but everybody is not going to do what they're supposed to be doing,
Mhm.
which can make it more on uh, one or two or three individuals.
Mhm.
But as far as the topics, I think you kind of covered them all. But that's one of the places where I fall into as far as the long distance caregiving. That's dear to my heart because a lot of people think they're long distant and there's nothing that they can do, but there's a lot that you can do.
One of the things that I'll add that the class also did, going back to the question that Dr. Epps was answering in terms of, like you said, it wasn't taught different. It wasn't different information. It was just delivered differently. But what the class also allowed you to do was establish a community with other individuals that you could speak with outside of the class who were basically in the same boat as you, and you could connect with them more easily. Uh, from her class, I was able to find a group, and that group had some couple of married people in it, and taking care of a parent and taking and being a spouse, there are similarities but there are differences, and in talking with the other spouses, we were able to connect on what it was like being a spouse taking care of another spouse. And I'm sure the people who were taking care of parents could connect on what it was like, being a child taking care of a parent, especially if you and that parent didn't have a great relationship. So it was also a way for you to kind of vent and talk through maybe some of your frustrations, and that's what the class also allowed us to do in terms of establishing bonds and relationships beyond just taking the class together.
Yep. Thank you, Mark. And when you said that, I would say, because I know Jed may be like, well, I'm trying to still see what's relatable, what y'all changed up, because people are like looking for it specifically instead of saying we did this, and some of that wasn't it. What I'm gonna just tell you, I think what was so special about this course, it created a space for for Black caregivers to safely learn, right? They're not being judged. They can ask the questions. They do not have to be like, oh, they're going to think I'm stupid, or, all of this stuff. It is a safe space for them to learn, but it's also a safe space for them to emotionally share.
Mhm.
I think that's what we created. And even for that online course, we have it's called a virtual bulletin board. They call it Padlet for those that are familiar with it. And it's almost like social media, and we embedded it in the course so caregivers can put their emotions, what's going on, and other people can like it, send a heart, give an emoji, also respond with an encouraging word. So again, I think when we did all of this, what we created was this safe space for our caregivers to learn and for them to emotionally share. Because
Mhm.
when they're in a broader class, a class that's mixed with different um, races and ethnicities, and I can just speak for me. Sometimes I may not want to speak up, right? I'm not bold like Mark and speaking up all the time. You have those families, no, I don't, or you don't want to cry,
Mhm.
or say something. But when you have a group that is designed for you and everybody, we know this, we don't have to talk about our day that we experience racism because we experience it every day and we know that was experienced.
Mhm. So just to piggyback on what you're saying, there, in the very beginning, I was attending
Mm-hmm.
groups on Wednesday, groups on Tuesday, whatever Emory was offering, I was there. And what I found in attending the groups is that when they were the majority white groups, those individuals had formed relationships where they were care partners with one another.
Mm.
And when I finally joined Alice's group, I was able to form relationships with others, and I can't even say I was a care partner. What I started doing, I started bringing the group together because I felt like we were meeting online, but then everybody was just in the house. So, like with my son when he was younger, all the kids used to come to my house and we would do play dates. So I started doing play dates for the caregivers. So I would cook or have something, or we would try to meet up at a restaurant or somewhere. And sometimes we would bring our LOs and sometimes we wouldn't. Now, not everyone participated, but for those who did, it was a great experience. So being in a base almost a homogeneous group, it allowed you to bond with people without feeling like you were going out of your way to bond with them. And by it being more cultural, we clicked. There was a guy, his wife, well, actually he was Caribbean and his wife was Caribbean, so we were able to talk about some things in terms of the Caribbean culture that I was experiencing with my wife, that someone in the African American community may not necessarily have experience with their wife and the wife's family. So again, it wasn't necessarily that we learned different material. For me, it was more so the being able to connect and bond with people and establish caregiver support with one another outside of the group.
I would like to add to that as well. It also give you the opportunity to listen to other perspectives of what families are going through. Someone may ask a question and someone else may be afraid to ask that question. So when you're in a group talking about these things, it opens the door of reception to new ideas on how to handle a certain situation.
Yeah. Thank you. Thank you. Well, Stephanie, I know we got like 2 minutes left. I don't know the whole time frame. So I'm gonna turn this back over to you so we can be respectful of everyone's time and also your agenda.
Actually, you're just fine here. We've got until 7:30, so we have
Oh.
plenty of time with you all. I'd just like to say thank you so much. This is so valuable, really powerful. Mark and Tanya, really thank you for sharing your stories and experiences, and let me encourage folks. I'm sure there are more questions. Actually, let's go ahead and turn the gallery on. So if you folks want to, you're welcome to turn your videos on, and you can raise a hand and contribute to the conversation. And there are many things that I've written down and kind of questions that I have. Let me ask this one. So I'm conscious of the fact, Mark, that you're caring for your spouse, and Lisa, you're caring for a parent. And so, we have the difference between kind of an adult child and a spousal partner here. And how did you feel about being kind of were you in a group, a mixed group, where some people were spouses, some people were partners, some people were, daughters or sons? And did that make a difference for you? Was that a barrier? Was that helpful? Did you even notice? I mean, it's something that we think about as providers. Do we mix people? Do we try to, separate them according to their relationship with the person? And I'm wondering if you just have any comments on that.
Yeah, for me, it was okay. I actually I didn't mind it being a mixed group. Just to be very, what are the words we use now? Vulnerable, frank, upfront. I don't have a great relationship with my parents. So it was kind of nice to see people taking care of their parents and who had a great relationship with their parents. So I didn't mind a mixed group. One of the things that uh one of the I didn't want to be in a group with a lot of women, so I ended up finding a male group, which was very helpful, because that gave me a different type of being able to bond with other individuals. And as our group on Saturdays went forward, there were a few more men that actually joined the group, so that was helpful. Not that I have a problem with women, but it was kind of nice to be able to share, especially as a man who's married, or even as a woman that's married. We as spouses, we have lost, our person, and not only we've lost a relationship, we've lost the whole person. Like I would tell people, y- you know, um, it's a difference hugging your wife or helping her with her bra when she's getting dressed in the morning, where you can have those flirty moments when she's still a whole person, versus when you're having to dress her and there's, like, no emotion, there's nothing, no intimacy, within that moment, no nothing. It's just you getting her dressed. uh so, I would share with individuals, and Doc sees my Facebook page. I would share with individuals who are currently couples, hey, enjoy this. I know people hate Valentine's Day, but I wish I can have one more day with mine. So there, and I think as men, we were able to open up and talk a little bit more about what we were feeling, versus doing that with a group of women, even though the women may have been feeling the same thing. So for me, it was I didn't mind the mixture of parent and spouse, or even, I think we may have had a person taking care of a sibling. So I didn't mind that. But I did appreciate that there was a men's group that I could attend via Zoom, that Jim Kelly runs out of California. So that the mixture wasn't a big deal for me. It was actually appreciative to see people who had great relationships with their parents, um, and also seeing people who were taking care of a parent and the other sibling was not taking care, helping to take care of it. It made me kind of wonder, well, should I have another kid just in case something happens to me, and the one I have is not willing to take care of me, I may have a backup. So, but it was, I didn't have a problem with it.
Tanya, any reflections from you? Thank you, Mark.
Um, I think he did very well. Don't have anything to add to that.
Mhm. I did notice, Fayron, that 78% of your group were adult children. And that the majority of them were female, and so definitely a divide there. And I'm wondering, is that something that are you noticing more? I mean, when we think about caregivers in general, that, this is largely a women's issue. No, I don't want to marginalize anything that you said, Mark. Women tend to get the, more attention drawn to this. And I'm just wondering if you noticed, did you feel like there was any cultural impact with it being more adult children, or more daughters?
Or more women, yeah, or daughters, like you say. We kind of talked about this at a family caregiver advisory board meeting. It's not, because while I'm out there recruiting, it's not that they do not have men that are in this role. We had this great discussion, is men taking that next step and joining a group or receiving that education. That's where we've seen that challenge. So when I'm out recruiting and engaging, I run across a lot of men that are maybe taking care of a parent or taking care of a sibling or a partner. But it's getting them that next step to, hey, enroll in this study, or better yet, go to this support group or get this education. It just kind of stops right there. And we were having this discussion just last week of how do we get them to go beyond that?
Yeah, I think there was a big conference on the experience of male caregivers,
Yeah,
recently.
and just to add, like I would say to people, you have to remember that men aren't raised to be caregivers. Men, it's not, a little boy washing dishes is a no-no. You have women in the house, the women wash the dishes, the men go out and shovel the snow and rake the grass and do all of those things. I guess I was just fortunate that I was a latchkey kid, and so I had to learn how to cook, and I had to learn how to do things that were considered, women's work. So, washing clothes and doing all of those things I had to do was not a big deal. The other thing is that men aren't necessarily ones to talk about their feelings. Men just go out and do. There have been several people who've reached out to me, that I coworkers who have a friend whose wife has dementia. I told her, yeah, give him my number. I haven't heard from him to this day, but the mother-in-law, I gave her the information to join the group that we have on Saturdays, and maybe he will, eventually come in. But even in our group, men will come and men just fall off, and they just end up excuse me, they just end up doing what they're doing, and they don't want to talk about it. And I think that's why you see, when you go out into the world, we have road rage. That person isn't mad because you cut them off. That person is pissed off because they have this hour and a half commute home in traffic from Atlanta, and they have to go home and take care of their spouse or their mother, and they're just overwhelmed. So the mental health breakdown started long before you cut the guy off on the road. And I think we don't take those things into consideration. There are a lot of people out there struggling, which the pandemic actually revealed, that there are a lot of people just out there struggling that didn't like their spouses. You saw a high rate of divorce. And it kind of made, in some instances, people love one another, because I used to go in my son's school, and whereas they would kick me out right after the pandemic kind of let up, they're trying to keep me there to talk to me. And I'm like, well, when I was coming in here holding you accountable. You didn't want to see me. Now you realize you hadn't had anyone to talk to for a while. You want to hold a conversation. So there are a lot of people out there that's just struggling, period. And I think that's why sometimes Alzheimer's, or even like my wife was officially diagnosed with depression in the beginning because no one really knew about FTD. Uh, so there are other things that need to be addressed outside of this, just in terms of mental health.
Mhm.
I agree with that. And as far as educating the different types of dementia, because there are some that have similar uh, effects on a person, I think education is very important. And I would like to say, yes, a lot of caregivers hold a lot within because they try to be the strong individual. They try to keep it all together, but it's really hard. And you have people who are demented, they cannot communicate to you and you're used to communicating to people on a regular basis. Say, for instance, right now, both of my parents are affected. My father is stage 4 cancer. I have a sister here who lives about 30 minutes away who drives every day. Yes, we do have caregivers coming to the house, but that's very expensive, so she's having to spend majority of her time, I would say, away from her husband, and her husband comes here to support her. Like during the snowstorm we had last week, my
Mhm.
sister and her husband, they had to spend a night because they didn't know what was going to happen. They didn't know if the power was going to go out, you know. But I say that to say, when you're caregiving for a person, there's a lot, like Mark said, there's a lot of mental, there's a lot of depression, there's a lot of regular life things you're not able to do. There are friends who you cannot even hang out with because you're taking care of your loved one. It's not that we're complaining to do that, but your life changes. Your life changes big time.
And I want to ask both of you, Tanya and Mark, Tanya, you brought up something like, oh, yes, we could do it all, right? I
Mhm.
want to speak to this because I know, especially, I work with some researchers that talk about the superwoman schema, especially one Black women, but then also the men being a Black man and saying that you can handle this. I want to kind of speak to that to see. Have you all experienced any of that or know any people? I can just share with mine, some of my college mates, my friends, they'll tell me that they're caring for their mom and I want to help, but then they are saying, I can do it. I can do it. 'Cause especially Black women, we've been raised to take care of everything and do it all. Um, and that's like just in us. And I think also for Black men, I don't identify as a man, but I've
Mhm.
heard that you feel like you could do this as well.
I would just say for me, um, I've never wanted to be Superman.
Okay.
I look back on my life. I was always a team player. I say that's what kept me from getting a basketball scholarship. I was willing to pass the ball and get the teams involved, and I didn't know when to take over. And even in this journey with my wife, I was trying to rally the family and get and be, it was a team effort. Hey, this is what's going on, but due to my wife's dementia, she had told people I put her out the house when I didn't. And so there was, and in this current climate, we have this thing between men and women where is this conflict, when it comes to relationships. So I just remember saying to myself, you know what, this is just like high school when I didn't take over the game. And once I took over and cut everyone off, and did it myself. We got the diagnosis, and I just took care of her. I gave everybody an opportunity to shoot the ball. You didn't want to shoot, so I'm shooting. So I became Superman by default because no one wanted to step in and help. I even asked my father, would he come and help me? And he didn't show up. No one showed up for me. And what I've come to realize about those of us who are in the caregiver role doing it by ourselves, very few people have come to show up for us in our lives. Like I moved here at 18, very little help from either of my parents. I know other people who are only children and they're taking care of a parent and no one comes for them. Now, the other thing that I found that I had to teach myself and some others is that when, like myself, as a caregiver, even though I was taking care of my wife, I would offer to help another caregiver, and they would turn down the help because they're thinking of me. And I'm like, look, just say okay and bring your mother over here. She can sit with my wife. They can watch TV. I'll feed them, and you go do what you're going to do. Go have fun. So I had to learn to say okay when people were helping me. My neighbor, she was taking care of her mother and father, still taking care of them. We have always brought food to one another's houses. So when I would food prep, I would take her, food. She would bring food over here. Her husband, I would take him, hey, let's go to Outback and get some steaks and just get him out the house. He was more physically disabled than anything else, but I was Superman by default. And when I look at the caregivers who don't have anyone coming to help them, they never really had help. They've always been the person that everybody counted on and depended on. So in some instances, the people who don't come to help you, they don't know how to help. They don't know how to help. They say, oh, they got it. I've seen them, overcome other adversities. I'm not worried about them. And once I came to that realization, I became Superman by default.
Oops,
You're on mute.
you're on mute.
Mhm. So, anything you would like to add, Tanya? Because I do have a follow-up question.
Okay, sure. I would just like to add too that, like Mark mentioned, a lot of people will say, I'm willing to help, whatever, and they don't show up. But sometimes you just want to have someone there to just sit down and talk to. And I would like to commend our social worker. Just yesterday, she came by and she sat my sister down and she just asked, "How are you?" Something that simple just to get us talking. We weren't talking about the parents, she was talking to us to figure out what we're going through, what we needed. And that meant the world because you were able to get your mind off of the situation and focus on yourself for a brief moment. Because as a caregiver, you hardly ever get to care for yourself, so to speak. And that's one thing that we as caregivers need to learn how to do is be able to take time out for you. It may be just go outside, sit on the front porch, smell just a breath of fresh air, just to get away from the moment. Because with people who have dementia, a form of dementia, you never know what situation, you never know what their thought pattern is at that moment.
Let me add this real quick, Doc. When Tanya, when you were saying take care of yourself, a couple of things. Sometimes we have to advocate to take care of ourselves, even within our own support group. The other thing, and I would say this is another takeaway for professionals, the social workers, when you're sitting down talking to people, find out what the care that loved one can still do. I had started cycling, and then I ended up buying a tandem, and I would take my wife with me. And I learned that we couldn't go up hills because I had to tell her to pedal and whatnot. So I couldn't ride Stone Mountain, which is very hilly. But we would go out and ride other trails, and it was very enjoyable. She enjoyed the fresh air. I actually think it kept her alive a little longer. And then also my son would go riding with us on Sundays, and I got her up to like 16 miles. She couldn't go and do the 40 miles with me, but I got her up to 16 miles, and it was time that was well spent, memories that I could keep. I would also suggest that to the social workers that if the people can capture pictures and videos, it helps. I go back and she stopped talking, but I could go back to the videos and hear her voice again. Now that she's gone, you know, there are times I go back and look at certain pictures and certain videos of us together. You know, but I just wanted to throw that in there because even though they may have dementia, they can still go to the park, if they can still eat ice cream, you know, get out, you can get outside with them. And what you'll find is that sometimes people will come and interact with you. So you kind of get a break without necessarily getting a break. Because there were times we just sat in the park. She's on one side of the bench. I really didn't have to talk to her because, you know, she had FTD and she was losing her ability to talk anyway. So we just kind of sat there and would look at each other and hold hands, and she would eat an Italian icy or something. So
Awesome. Thank you. Well, Mark, Stephanie, I'll turn it back over to you.
I wanted to give, Shira, I know you had a question in the chat, and so I wanted to make sure that we got to your question. You want to unmute yourself?
Sure. Thank you. A couple of comments and questions, but first a big thank you. So I too am a social worker with CaringKind, and I'm engaged in community building, primarily in the Jewish community. And I myself have an Atlanta connection and an Emory connection. So it's fun to hear about the experience of Stone Mountain and whatnot. So much of what you each shared in this beautiful interdisciplinary panel really resonated with some of the things that I often hear in at least one of the support groups that I facilitate, that is with adult children. And those adult children who are African American have explained the differences and the similarities and have pointed out the contrasts along the way that they wanted me to be mindful of. One person talks about the role of faith and how belief in God and being able to turn and hand things over to God has been what he feels is what saves him and what grounds him and gives him the strength to go forward, which is why I asked the question about the faith-based community. So I'd love to hear a little bit more about that. That same person also talks about the idea of being superhuman. Like, I was the one that did it. I had other siblings, but I did it. And so everyone just figured I could do more. But now I'm feeling the weight. It's taken a toll. And I realized that I can't do it all. And realizing that everyone thinks I can do it all. And how do you manage that when there's a disconnect? So I thought that was fascinating. And I think the experience that was most telling for me was when I was working with someone one-on-one, and they explained to me that the Wanderer Safety Program that we refer folks to, which is like a bracelet that you can wear should you be concerned that someone is going to wander, involves contacting police and other first responders. And the person said to me they were in an intermarried relationship where one person was African American and another was Caucasian, and the care partner was Caucasian. And she said, when my husband went missing, and I could see it on the tracking device, which was paired to the bracelet, because we have low tech and high tech, I learned that in that moment of panic, of not knowing if my husband was safe, rather than contacting the police that could potentially locate and bring that person to safety, my first instinct was to chase the bus that I now realized he was on and slam on the bus, even if people thought I was acting in a way that was, because I didn't know how he would react in an interaction with the police. And it was so profound and it moved me in such a huge way. So hearing all of these things come together has been very, very, very helpful. I thought about what you were saying, and I thought about the shorthands that you were describing, that the changes are not content. It was delivery, it was representation, it was modeling. And, I really want to see how we can echo some of these really tremendous forms of success you've had in bringing this to the community. Could you maybe share a little bit about your work in faith-based organizations? I know you popped something into the chat for us.
Sure. And Shira, thank you so much for saying that about that, the wife that banged on that door, because that was actually my follow-up question. I wanted to kind of talk about that because I wanted to challenge the social workers or anybody that's on this. I want y'all to really think about the experiences, just not being a caregiver, but being Black in America and how that intersects with a caregiving role or living with dementia. And so that is really important, because when someone is saying contact the police, you got to understand that this particular, what is that history, right? And it can also be being in the Mark, I don't know if you want to speak to this. You're probably tired of speaking, but it could be being in a public space, right?
Mhm.
And being a Black man with a smaller size spouse. I knew Lisa was much smaller than Mark.
Right. Yeah.
But and just knowing if that person was to shout out something, what's going to happen to that spouse who is the care partner,
Mhm.
and the way society is set up?
Mhm.
Are they going to run to the wife that's shouting, not knowing that she has a diagnosis of dementia,
Mhm.
and then cause some harm
Mhm.
her spouse? So, it's just things like that I want us to really think about, not just in our role as a social worker, but in our everyday life when we're interacting with people, with human beings. Just think about that. Yes,
Mhm.
Mark?
So that we didn't, no one called the police, but we were at the grocery store, and you know, I've taught special ed, and Lisa has declined. So I was talking to her like I would talk to, one of my special ed students who was in the severe and profound class. And again, not just, the police, but going back to the social issues we have nowadays between Black men and Black women in terms of relationships. A Black lady got mad at me and like, why are you talking to her like she's a child? And I had to explain to her she is a child, she has dementia. One of the things about my wife, and Dr. Epps can attest to this, she was always dressed nice. If you didn't know she had dementia, you wouldn't know. She smiled at you. She was still very friendly. She was quiet, but she was always well dressed, well groomed. And so if you didn't know, you didn't know. And the lady was just irked with me because I was talking to her like a child, and I had to explain to her that she had dementia. And then her whole demeanor, oh, I'm so sorry, and blah blah blah, and you're a good man for hanging it. And I'm like, not a problem. I didn't get offended. I got in my car and I left because I was aware that that could happen. I
Yeah.
was aware because even with her family, I had some people over, and one of the ladies went back and told someone else they didn't like how I was talking to her. But when asked, well, how was I talking to her? I had to give her instructions like she was a kid. And when you're not around this 24/7, you don't understand it. So, everyone is going to have an opinion and see something that they think is an issue. And you just have to be ready. You have to be prepared to be able to explain it.
Yep. So thank you for that, Mark. And then going back to my work with the faith communities, I have a program called Alter. And one of the things here, when I was working with many persons living with dementia, particularly Black individuals, faith kept coming up. The church, and what was happening, families weren't bringing them to church. They had stopped going for various reasons. And so through my work with educating the community, the church came back up. Right. And that's what Alter is. Alter is where we partner with Black faith communities across the country to create these dementia-friendly faith spaces so families can feel more welcome, belong, get the resources that they need also from their faith community, and come back and get spiritually supported, because that was so significant for those living with dementia. And then also what's significant with working with our faith communities, especially in in the Black communities I work with, many times they're under-resourced and underserved. So the church, me building up the capacity of the churches, is now bridging in or filling in that gap that has been existing in that community. So now the families can go back to church, not to just worship, but also to get the resources and the support that they need. And that is the gist of the Altar program. I have worked with others outside of the Black church to share the framework. It was one synagogue we worked with, and I shared with them how to do an assessment, because that's what we do first. We have our churches assess their congregation. So you can really see what that need is. Because from the pulpit, everybody looks this one way, right? And some people share, some people don't. So it's really important to survey them so you'll know who is in your congregation, who you're serving, who you're teaching, and then you can create services and support for them. So that's the gist of the Alter program. We have a summit coming up in April for those that would love that want to learn more, where we're bringing our faith communities together, caregivers, persons living with dementia, and we're coming together so we can brainstorm and create our own solutions. I really feel that the solution to this dementia journey, caregiving journey, can be found in the community. If we come together and we have these conversations and we learn from each other, then we can create programs that work for us.
That's great. This has been so helpful, and I'm conscious of the time, and I'm hesitant to stop us because this has been so rewarding and so rich and so valuable. And so I want to say thank you again, you know, for your vulnerability and for your willingness to share with us. Are you all seeing my a slide now with the program evaluation? Did I share the right thing? Okay, great. Thank you all for coming. I just want to let you all know, you know, as I said at the beginning, we received funding from the Hearst Foundations to be able to host this and to be able to do it free of charge. And we will be continuing to be doing these professional development series webinars on a monthly basis. Next month, we have Dr. Kathy Supiani, who's going to be talking about the unique experience of grief for dementia caregivers. The following month, we have Dr. Kathy Pearsall, who's going to be talking about caregiver readiness. So stay tuned for that. I would ask you all to please take, like, literally, there are like 3 questions on this program evaluation. And if you could please complete it for us. If you're interested in getting social work CEUs in the state of New York, you can do that by following this this link to here as well. So please complete our survey for us. Please reach out and let us know if there are particular topics that would be helpful for you as we're kicking off this series. We have 2 years of funding to be able to do this, and so we're really, really excited to really bring this pool of people together. Thank you again, Fayron, Tanya, and Mark. This is definitely, I think, been more than we could have anticipated, and this was really a wonderful and powerful conversation. And I hope that didn't sound like a microaggression, because now I'm very conscious of everything that I'm saying, but we're really grateful.
Can we answer Donna's question real quick? Because I think it's a good question.
Yes, absolutely. Go ahead and do that. And I just want to, if anybody needs to sign off, feel free to do that. But yes, go ahead, Mark.
It wasn't necessarily in the class itself. We talked about that as we form, partnerships and relationships with one another outside of the class.
Right. And Donna's question was, conflict resolution amongst family members. Was this an important aspect or addressed in this training? Does the training explore strategies for managing situations where certain family members, can attempt to exert control and, some of those dynamics? I can tell you, I think from my background and experience in working with caregivers for almost 20 years and families, that family conflict is it's a very common phenomenon. I think that cuts across, race, gender, ethnicity, geography, socioeconomics. It's a big topic, and actually that might be a good one for us to loop into this series. So thanks for bringing that up, and we'll see if we can't address that in the future. But thank you again, and I would encourage you all. I did drop the Alter Summit information in, and if you could all just ping Fayron and tell her that she should let us implement her program at CaringKind. We'd like to just go ahead and do it. She can do the research. We know that this is powerful, successful. So we want to try to amplify that work and get this great work out to the families who need it. So thanks again, everybody, for joining us, and hopefully we'll see you all next month. Thanks.
All right. Bye-bye.